So hey, here we are at the Ben and Gary Show. We know dentistry, and we're coming at you again with answering questions that our viewers will send in to us. And I believe our most recent question that we've had, Gary, is sleep apnea. What is it? And maybe you can break down like what that is. I know it has something to do with breathing here, so maybe you can start there.
Yeah, so the most common type is called obstructive sleep apnea, and that is when people are asleep and the airway is somehow closed. Or
so they stop breathing, they
shut down, or
multiple times.
Restricted,
restricted.
And yes, they'll have periods of during their sleep where they don't breathe, and they just stop breathing. But luckily there's a mechanism where the CO2 builds up in the bloodstream, and there's a little trigger that says you got to start breathing again. But then they will take a big deep breath and start breathing. But these periods where they stop breathing can be, a pretty extensive period of time. It can be up to a minute or so, and there can be repeated episodes within the hour. And so, when they have these episodes, of course, it leads to interrupted sleep, and they don't get a good night's sleep. And so, in the morning when they wake up, they will sometimes be irritable. Imagine that.
Yeah, imagine that.
They haven't
maybe not fully rested.
Right. And then of course at work they could be have lack of focus and
fall asleep on the job,
or fall asleep, and that can be dangerous, of course, when you're driving.
Yeah, depending on what kind of work that you have.
Right.
It could easily lead to a major accident, if possibly.
Right. So that's why we as dentists have to be more on top of that type of problem and recognize that and talk to our patients about sleep apnea and methods to how it can be diagnosed and how it can be treated. So the most common way to treat it, though, is to see a sleep doctor or
sleep medicine, physician in sleep medicine.
Right, and
what do they do?
They will have you do either a sleep study, and they can send you to a sleep study clinic, or they can give you a device that you can hook up, and it'll actually measure you at home in your own bed, so it's like less stress, really. But
is it more common in, I say, men or women?
Yes, it is. So men are much more likely to have than women. Obesity is a factor.
Neck size has something to do with it.
Yeah, 17 inches or more.
Right.
But I think the main thing is that once recognized that you should really have a sleep study done, and when you go, they'll have, of course, monitored, but then they'll also measure different types of things, such as how many times your sleep is interrupted in an hour, and how many. So actually, they'll measure how many episodes you have.
Right. So they get the level of severity on what to do, and so that certainly may lead to a decision process.
Right. So obviously, the more times or more episodes you have within an hour, the more severe it is, and of course, the less it's less severe. And oftentimes, the probably gold standard is to have the CPAP device, which is a continuous airflow. That is, they have a mask that you have to wear.
Yeah, it's not the most comfortable or it's not the sexiest looking thing you can have when you go into bed there, I don't think.
Right. But it's a continuous air pressure that helps to keep the airway open so that you do get a good night's sleep.
Right.
Now, some patients and friends that I've talked to swear by it and cannot live with it or go to sleep without it, and it makes a huge difference in their lives. I mean, they wake up refreshed and they're ready to go. But some people cannot tolerate a CPAP, and so that's when.
So there's some other things that we can maybe as dentists do.
Yeah, that's where dentists come in. So, of course. So
well, you're kind of like our sleep apnea or sleep medicine expert in our office here, and I know you have a few devices that you've made here.
Right.
What does the major component of why that even works?
Right. So there's a mandibular advancement that's.
So do you wear something in your mouth? I mean, so it's custom made sort of to fit your teeth.
Right. So it's custom made. It's obviously we would take impressions of your upper and lower arches, And then there's a device called a George's gauge that you can measure how far you can move your lower jaw forward, how far you can intrude it, and then we take a measurement that's usually about over half or not quite 3/4 of the way forward.
So what really is the benefit of having the jaw forward versus back?
Yeah, so the whole object of having the mandibular advancement or lower jaw moving forward is to bring the tongue off the back of the throat. So you can imagine with your jaw in a more forward position, when you're sleeping, it actually opens the airway. Yeah,
Mm-hmm.
so that's the ultimate reason for wearing one of the oral appliances.
Is it foolproof?
It's not foolproof. I mean, you can still have some degree of snoring, but it does help much more. I mean, and you can imagine it's a lot easier to take a mandibular device or an oral appliance on a trip rather than some type of CPAP.
That's true. Yeah.
So they have smaller CPAPs now that you can travel with, but I don't know a whole lot about that. But
Right.
But they're more portable versus the full blown device that you would have at home.
And hopefully TSA doesn't confiscate it, right?
Right. Exactly. Yeah. That would not be nice.
No, you're like, no, you can't,
Yeah.
you can't, you don't understand.
Yeah. Right. Right.
Well, you brought up a good point there about snoring, and I've heard that snoring is a lot like apnea, or is it really apnea? What's the difference? I mean, if you snore,
Yeah.
do you definitely have sleep apnea?
I think that you probably do to some degree, but it's not as severe. But again, with snoring, you still have some oral appliance that will move your lower jaw forward to bring your tongue off the back of the throat.
Mm-hmm.
So some patients have been very happy. They've stopped snoring completely. So I think obviously they have a much less severe case of sleep apnea. But I think overall, if you're snoring, then there's a good chance you have sleep apnea.
Yeah, I think there's a high degree of chance that you have sleep apnea, but I do know that just because you snore doesn't necessarily mean that you have sleep apnea. I think or that you stop breathing in that process. It could be another point about whether if you're a nose breather and you don't really have very good airway through the nose, that you can lead to sort of snoring in that sense here. But I think you're right. There's probably a pretty good chance that if you're a snorer, there's some apnea involved.
Yeah, and most people are married, so their partner can tell whether they actually stop breathing at some point during the evening. So that's
So
really
all the single folks out there here are kind of in a bad situation.
They're probably scratching their head, right?
Right. They have no idea that this apnea issue is occurring.
But the thing is that if you leave it untreated, then there are other medical ramifications, such as high blood pressure and strokes, diabetes.
Correct, yeah.
So those are some of the complications that can occur if you do not get it treated. And the most severe is that sometimes it can lead to death. So it's not something you want to fool around with.
Right. Right. So if you were to have someone who you had to come through, what would be the first step that you would recommend that they take? If a person comes in and says, "Listen, my partner, my spouse is telling me that I'm snoring," what do they do?
So we would first refer you to a sleep physician, someone that specializes in sleep disorders. And they would, of course, either do a home sleep study or send you for a clinic for a sleep study, and then see what the results are. Read the report. So,
Correct. Yeah.
Yeah.
Is there a need for like a follow up after somebody goes through with this process here? If they've gotten their CPAP and they realize that I've stopped breathing and I need some help with this here, how do they know it's even working?
Well, that's a good point. Even with us, when we give an oral appliance or in that case a CPAP, they would do a follow-up sleep study to measure the episodes again and see if there's improvement. Even when we do the delivery of the mandibular devices, it can still be calibrated so that if you don't feel like you're getting a good night's sleep, we can. They're made so that you can advance the jaw a little bit further,
adjust them a little more.
Yeah. But the problem is that sometimes it can lead to a little bit of TMJ issues. If you're too far forward, so you want to back it off from there. But
have you had any patients that have had any further dental issues after they've worn their device? Like, say, for instance, they feel like their bite might have changed or tooth positions may have shifted.
No, definitely. After they wake up, it'll take a little bit of time before their jaw or their bite feels like it gets back to normal, because you're in a advanced protruded position. So it does affect your bite for a while, but over time the muscles relax and your normal bite will return in sometimes in a few minutes, sometimes in a half an hour, but it does get back to more of a normal feel.
I've always known that nothing really lasts forever. So, for instance, if dental work has been done and you get your oral device and now you have to have something else done,
Right.
Is it a way to be able to? Does that mean you have to get a whole new device?
If it wears out, yeah.
But I'm just saying, like, if they had a crown or they had another filling.
Oh,
on
I'm
that,
sorry. Yeah.
Is there a way for them to be able to?
Well, hopefully we can
to
make some adjustments to, seat it properly. But if you can't adjust it, then it would have to be remade. So that's a good point too, because you want to make sure that any dental work is completed, such as new fillings, new crowns, before you actually have this made.
Sure.
That was a really good point.
Yeah, I think that sounds like it to me. It's a matter of making sure that you stay on your regular maintenance programs in the office there, so that you have less chance of that actually happening.
Right.
And so then if you just can't neglect things and without there's always some maintenance involved with everything you do. And so I think that for us is like, gosh, minimum every 6 months in to see us,
right?
And bring your snore devices in, and if you have other things like a night guard, you should also bring that in too. But that's for another subject.
But I wanted to bring one last point. I recently saw Drew Cobb at a lecture, and he was talking about sleep apnea, but and how it affects children. And so,
for the record, Andrew is a dentist, right?
Andrew is a dentist. He's Georgetown grad, just like I am.
Right.
And you went to where?
Right, exactly.
University of Maryland.
Only the first dental school in the world, that's all.
Right. But, okay, nice. But what he said was that oftentimes children with sleep apnea can be misdiagnosed as having ADD just because when they wake up they're irritable, they lack focus, and oftentimes it can be just because they are not getting a good night's sleep and have sleep apnea. So that's something just to keep in mind for you parents that have children that may not be performing as well. It may be a sleep issue, sort of a sleep apnea issue.
Do you think they would have snoring issues, or would they look differently in the child?
I would think they would have snoring issues, yeah, definitely. So, anyway.
And so I shouldn't have kicked my kids out the bed when at an early age like that. I should have been monitoring them whether they're sleeping or not.
Right.
Is that what you're saying?
Right. Yeah.
Okay, well, I'll take that under advisement for next time.
Yeah.
Well, and speaking of next time here, it's the show's over today, so we'll see you next time. It's the Ben and Gary Show. We know dentistry. We'll see you.
Bye.